Hello, and welcome to our video today where we will be discussing person-centered care. What is it and ways person-centered care can be implemented, in particular by implementing direct patient care activities. Let's begin by discussing what person-centered care is. Person-centered care can be described as an approach to care that consciously adopts the perspectives of individuals, families, and communities, and sees them as participants, as well as beneficiaries of trusted health systems that responds to their needs and preferences in humane and holistic ways as described in McCormick and McCants. Now let's delve further into patient-centered care and discuss ways to implement it, in particular with direct patient care activities. What does this mean? This can be defined as the care of a patient provided personally by a staff member. Direct patient care may involve any aspects of the healthcare of a patient, including treatments, counselling, self-care, patient education, and administration of medication. As with most things, person-centered care has its barriers, which include traditional practices and structures, time constraints, professional attitudes, and being sympathetically present.
Working with patients' beliefs and values. To reinforce one of the fundamental principles of person-centered nursing, we can work with the patient's beliefs and values. This is a productive way of gaining a clear picture of what it is the patient's values about their life and how they make sense of what is happening. To really appreciate each patient as an individual human being requires us to show we care about what they value and believe. We are able to use this knowledge to then understand that a person's history is what shapes them into who they are today, and the kind of life they want to live is influenced and directed by the choices they have made to lead them to this point. This history is what gives meaning to the patient's values, and this then gives us enhanced understanding of what it is the patient finds important. When we are capable of this, we can then integrate this individual information and create a plan of care specifically catered for each patient. Being sympathetically present. Sympathetic presence is described as an engagement that recognizes the uniqueness and value of the individual by appropriately responding to cues that maximize coping resources through recognition of important agendas in daily life, as mentioned by McCormick and McCants in 2010. To further clarify, we must understand where this context was based from. Sympathy means community or agreement in feeling, the fact or power of entering into the feelings of one another, especially in sorrow or trouble, or fellow feeling compassion. On a patient's perspective, presence means full concentration and attention is given to them. The nurse should think about their responsibilities and also should be willing to build a mutual relationship with the patient. They perceive the nurse as a companion during their experience. They feel inner peace when the nurse is not only task-oriented in providing medical care, but is someone who is understanding and accepting of their situation. A nurse must see a patient as a unique person with unique issues affecting them. They believe that a nurse should provide holistic care. Providing holistic care. Providing holistic care not only focuses on the physical or psychological needs of the patient, but also on the social-cultural, developmental, and spiritual variables. The physiological variable indicates the body structure and function. The psychological variable refers to mental processes and relationships. The social-cultural variable relates to social and cultural functions, and the developmental variable refers to the developmental processes of life. The spiritual variable then influences spiritual beliefs. This variable should be considered when working with patients' values and beliefs to meet their identified needs.
One of the main issues patients complain about when they stay in hospital is a lack of authentic engagement with the treating team. When nursing staff fully engage with their patients, collaborative decision-making takes place and both the values of the nurse and the patient are present and conveyed between each other. This has the correlating effect of increasing patient satisfaction with the care received, further improving the rate of adherence to the mutually decided treatment regime, as well as mitigating the risk of avoidable comorbidities occurring. The traditional process where the medical team take the lead and make decisions on behalf of the patients. A shared decision-making process helps to inform and involve the patient in his or her care and provides the patient with the right to make an autonomous decision in their best interests, as well as receiving support with making that decision. A shared decision-making framework also allows for patients to receive support in making a decision about their healthcare choices, especially in the case of complex or high-risk procedures. This also has a correlating effect of increasing patient satisfaction with treatment and adherence to the mutually decided treatment plan. Patients who receive appropriate person-centered care have consistently been found to have better outcomes than patients who have only played a passive role in the treatment process. As I highlighted before, this has a correlating effect of increasing adherence to the treatment regime by patients and a decreased risk of easily avoidable complications from occurring. The major issue highlighted by the other presenters is a lack of authentic engagement with patients during their admission. One solution to this issue is by implementing hourly rounding, which involves checking in with the patient on a regular basis, normally on the hour every hour, and asking a set number of questions to the patient to ensure there are no concerns which need to be investigated by either the nursing staff or the medical team. By regularly checking on patients, patients have actually felt important, and they have stated a sense of importance in numerous studies and have actually voiced their satisfaction to the nursing staff and felt satisfied with the care that they have received. As I highlighted above, implementing regular rounding with patients can increase patient satisfaction with the care provided, as well as increasing adherence to the treatment plan. By increasing adherence, the rate of failed discharges and comorbidities occurring will significantly decrease. The only issue that I need to highlight with implementing hourly rounding is for patients who cannot communicate verbally with the nursing staff. In this case, regular observations and objective assessments will allow for patient-centered care and authentic engagement to be implemented successfully, reducing the risk for these patients who are quite vulnerable.
Metro South Health uses the Plaintree components in regard to person-centered care. Other aspects of Metro South's commitment to person-centered care include magnet recognition. Plaintree is a non-profit organisation that provides education and information to facilitate person-centered care in healing environments. It is the only program to formally recognise excellence in person-centered care. Metro South Health is in the process of applying these components across their hospitals, community services, oral health services, and others to obtain formal Plaintree recognition. The 10 components of the Plaintree philosophy of care are: communicate through human touch, family, friends and social support, information and education, healthy communities, people caring for people, food as therapy, overall well-being, architectural and interior design, spirituality, arts and entertainment.
An example of person-centered care can be seen in practice through things such as Plaintree and magnet recognition of hospitals. This program signifies hospitals which provide excellent person-centered care to every patient.
In conclusion, to ensure we are providing high levels of patient-centered care, we must always endeavour to incorporate patient-centered care processes, direct patient care activities, and practice initiatives. By doing this and involving the patients and their families in decision-making regarding their own health, we are able to create an environment of support and safety to aid in a shared goal and better health outcomes.